Interface Video presents Fairhope Hospice Today. Brought to you by Fairhope Hospice and Palliative Care, Fairfield Federal Savings and Loan, Fairfield Medical Center, the Fairfield County Board of Developmental Disabilities, Dagger Law, and the Frank E. Smith Funeral Home.
Hi, and welcome to Fairhope Hospice Today. I am Kristin, President and CEO at Fairhope Hospice and Palliative Care, home of the Pickering House, and we are here at the Pickering House today shooting our show. I have a special guest with me today. Her name is Miranda Gray. Thank you for being here with us.
Sure, thanks for having me.
So this is an important month for mental health for the ADAMH board and just for all the agencies that you serve. So I thought we would have you with us today just to really talk about all those hidden gems that our community may not connect with the things that you guys do. So
Sure.
I'm happy to have you on with us today.
Thank you.
So can you tell me a little bit about yourself, just a little bit about your job and just a little about you?
Sure. So I am the Program and Quality Manager at the ADAMH board, and I've been there about 3 years. It's been wonderful to work doing lots of things in the community. Prior to that, I worked at one of our network of care agencies that we fund, New Horizons Mental Health Services.
Okay.
I was there for about 10 years. And a lot of the work that I did there was working in the community with adults that are living with serious mental illness. So I've had a lot of hands-on work and seen a lot of great things in our community.
Wow, that gives you so much. It gives you a whole different perspective when you can work and do those hands-on things. So you see not only what maybe New Horizons needs, what your clients need, and then you can take it back in your role that you've been in for 3 years.
Exactly.
Yeah.
Right.
So tell me just a little bit about, we were talking before we started, was just tell me a little bit about all the network sources. Is that what we call them?
Yeah, network of care agencies.
Yes, thank you.
So the ADAMH board, so I'll just back up. The ADAMH board stands for Alcohol, Drug Addiction, Mental Health Board. We have an ADAMH board in every county in Ohio.
Okay.
In Fairfield County, our board's role is to plan, fund, and monitor the behavioral health resources in our community.
Okay.
So we fund 14 network of care agencies in our community, and these are the real heroes in our community. They are out there working with folks in the community, serving our community. Some of the agencies that we fund is our local 211 information and referral, Big Brothers Big Sisters. We have behavioral health agencies that we fund. We already mentioned New Horizons Mental Health Services, Ohio Guidestones, Mid-Ohio Psychological Services, and even Meals on Wheels. So we're funding a great program through them where they're providing in-home counseling to homebound seniors. So that's been a really great program for us too.
Is that a new? I don't think I've even heard of that.
Yeah, we've been doing this with Meals on Wheels for about a year now.
Wow.
And it's been a great addition to the services that we're providing to the community.
I imagine that really is because, I think sometimes we forget that our seniors have a lot of mental health issues.
Yes.
They're secluded. Maybe they've lost a spouse or family. And so we kind of forget sometimes that those things are there, and maybe they can't get out like they would like to or need to. So that's great.
Yes, it's been a great program.
Yeah. Well, let's talk a little bit about the month of May.
Sure.
So the show that we're doing today is going to air the entire month. So why is this such an important month for you?
So Mental Health Awareness Month is really a time where we can just do just that, raise awareness about mental health and behavioral health and really decrease that stigma. There's so much stigma around mental health, but really we need to be thinking about mental health as our overall health. We all have mental health, just like we all have physical health. So it's really important that we start thinking about it like that and normalizing mental health so that people realize that it's okay and they take those steps to take care of themselves.
I told you before we started shooting that I'm a social worker, so I've been a social worker for 30 years, but today here I'm a CEO, but that social work piece is always in my brain and always kind of working because I guess sometimes it's hard to really put together, or for people to realize that mental health is really kind of the key that holds everything.
Yeah.
So we see so many addiction issues, so many family crises, just everything that you listed, food insecurities, and just all those things. A lot of times that stems from a mental health issue that maybe the client doesn't understand, the family doesn't understand.
Yes. Yeah, that's a great point. Is sometimes even with mental health too, things might manifest as a physical health condition. So it might be sort of brushed off that, oh, you know, it's just this or that, and not really realizing that it's a mental health problem.
How do you think we can do a better job of helping our community to understand that they do have these physical ailments, but really to look at the heart of taking care of your heart and your mind and those issues?
Yeah, I think that a good place to start as individuals is really just to engage in meaningful conversations about mental health. To talk about mental health in a way that is normalized, so people do start feeling comfortable about having those conversations. Share our own personal experiences. You know, talk about mental health to family, friends, coworkers, community. Just having the show today is doing just that.
Yeah, good.
Too.
That was what we were hoping. How, you know, why do you think that people have such a difficult time just talking about, even bringing up that conversation? Are they afraid that they may offend a loved one? Like if I'm a child and my parent, am I afraid to have that conversation?
I think that is sometimes part of the issue. We hear that a lot, especially around depression and suicide, that we're afraid to ask those really difficult questions because what if they say that they are experiencing something and we don't know how to respond? But the important part of that is really, I'm glad you brought this up, because really we do need to ask.
Yes.
We need to ask people how they're doing, and it's important to really ask twice, right? How many times does someone ask you, hey, Kristin, how you doing? You say, oh, I'm good.
Right.
But how often does someone say, no, Kristin, really? How are you doing?
Right. And the flip side of that is, how many times do I or somebody say, you know what, I'm not okay?
Right.
I mean, it takes a lot for someone to get to that point where they feel safe.
Yeah, you're right. So if we ask those questions and open up that door, that's the first step. And really, we shouldn't have to worry about what to say, because the most important part is just listening to that person and having that non-judgmental ear.
I love that. Sorry.
No, it's okay. Just not passing that judgment really helps the person to feel heard and comfortable.
You know, and I think as I'm going back to like my social work roots, that's always in me. I mean, that will never change, 30 years of that, you know, but you think about, you don't have to know all the answers.
Right.
You listening truly is the biggest thing. And then, you know, what you can say is, let's work this out together. Let's figure this out together.
Yes.
So let's take a second and give a phone number to our viewers that maybe if they have questions right now, where can they call to get more information?
Yeah, I think a good resource for our community in Fairfield County is that 211 information and referral.
Okay.
So that's a good place for our community to get those resources for things that they might need, right? Whether that's food insecurity, a connection to other resources in the community that might be helpful. Also, our local 211 is our 988 provider, and that's the suicide prevention lifeline, a crisis line. So anyone in Fairfield County, they can call that 988 number and be linked to a trained professional who can help them if the person is experiencing a mental health crisis. That would be the place to call. It also, sometimes our folks in Fairfield County know about 687-TALK. That also rings into the 988.
Okay.
I bring that up because 988 is sort of new.
Right.
And 687-TALK has been around for a while.
That's been around a long time. So if I'm experiencing some of those feelings, what if I can't remember these other numbers? Do I call, obviously 911 is always, you know, your go-to, but do they call 211 and say, this is what I'm feeling?
Yeah.
If they can't remember to call 988?
Yes,
Okay.
absolutely. All of the same professionals, they're all trained there. So 211, 988, it all dials to the same type of people who are trained to talk to anyone, whether it be a resource they need, or just talking to someone who can help them move them through their crisis.
How do we raise awareness not only about this, because this piece of the suicide prevention is really important to me. So, but just thinking about like this, how I'm sitting with you, and off the top of my mind, I don't think I would have remembered to call 211 to ask for that. So how can we help raise awareness for all of these things?
That's a great question. So at the ADAMH board, we do try to promote all of these resources. We have a suicide prevention coalition in Fairfield County, and we work really hard on that as well. But you're right, sometimes folks just don't know about the resources that we have available. So I think just working with our community partners, like with you all here, and just trying to help us spread that word. A great thing I think that we all can use right now is social media. Let's work as community partners and share each other's posts, right? And that way we're reaching more folks in our community.
That message is so strong when you can move that message, obviously on social media, but just any other outlets in town too. So, okay. Wow, we have a lot to talk about. There's a lot of great information. So I want to just take a second, and if you're watching our show today and you have any questions about anything that we're discussing, feel free. You can call us here at Fairhope, which is 740-654-7077. Go to our Facebook page, send us a question, go to our website, but also please feel comfortable to call 211. Any other information, any other numbers right now that would be beneficial to them, or just remember 211 and make that call?
You know, I think 211 is the most important resource. But you can also call us at the ADAMH board. So, you know, I'm there and I'm familiar with a lot of the resources. I also have a great clinical care coordinator who works with me, and she is really knowledgeable about what we have in Fairfield County as well. So either one of those are great resources.
Okay, that sounds great. So stay tuned with us. We're going to stop back. I've got a lot more questions, and I really want to talk about a little bit about some of the things that we see at Fairhope that really, as you're speaking, remind me a lot of the things that we do day to day. So I'm really excited to talk about that.
Okay.
Stay tuned, and thank you for joining us on Fairhope Hospice today. What makes Fairhope what it is our staff. It's always a question that we ask. Why do you want to be here with us? And what they most always say is, you've touched my life this way. You know, you took care of this person, or I've seen what you've done and I want to do that. And so the staff that have been here know what it takes. They've been on the other side. They see what it takes to make someone comfortable, to make the family comfortable, and really what kind of support they need. And so I think that's what really makes Fairhope what it is.
Fairfield Federal. When it comes to our customers and our community, we go above and beyond to help. Our people make the difference. Personal or business banking, whatever you need, we take it seriously because we know you do. Stop by today at any of our 3 locations and see why the difference is clear. Fairfield Federal Savings and Loan specializes in banking that revolves around you.
Member FDIC Equal Housing Lender.
I want a doctor who listens to me.
From primary care to specialty medicine, we put your needs first by treating you like a person, not a number. Our primary care team will help you identify your healthcare needs and set goals for success, regardless of where you are in your wellness journey. We care for patients of all ages, with offices that are close to you. Whatever you're searching for, you can find it at Fairfield Medical Center. Dagger Law has more than 110 years of experience in nearly every aspect of the law. When we're not just helping clients, we're helping the community. You'll see us at festivals, sporting events, and around town because we live and work here too. We are your neighbors, and we want to help you when you need it. When we help each other, we're stronger. Our community is stronger. Creating a strong, vibrant, healthy, and safe community is everyone's responsibility, and we take the responsibility seriously. We are local, we are trusted, we are experienced.
The Frankie Smith Funeral Home and Crematory in Lancaster and the Johnson Smith Funeral Home in Baltimore have a long and wonderful history of serving our community. Feel free to give us a call at 740-653-0652. Stop in and see us at either of our two locations, 405 North Columbus Street in Lancaster and 207 South Main Street in Baltimore. Respect for tradition, regard for change.
I don't think that many kids in my son's school even do it.
He makes fun of his friend who vapes.
He would never try it.
She's into soccer.
She's on the honor roll.
She's just not the type.
No way.
No way.
No way.
No way, my kid would never vape.
Get your head out of the cloud. Today, nearly 8,000 kids will start vaping. Maybe even yours. Learn about the dangers at talkaboutvaping.org.
It is so important for families to feel comfortable and safe when they call, because oftentimes that first phone call, even picking up the phone physically and just dialing that number, is very hard. You're asking for something that is a very difficult and private decision, and so we want everyone to feel comfortable and safe that you pick up that phone, you make that phone call, and let us just guide you and lead you where you want. And then you can make an informed decision about what's best for you and your family. Hi, and welcome back to Fairhope Hospice today. We have a really special guest. We had a great first segment. I told her we may have to stay over and do another segment, but before we get started with more of our conversation, I want to remind you that the phone number that you can reach us here at Fairhope is 740-654-7077. Please go to our Facebook page and follow us. We'll have some more information that you can find regarding our guest today. And please go to our website. So it's fairhopehospice.org for any information you need. All right, well, we are joined today with Miranda Gray, and we just have a lot of great topics. We're really talking about May as Mental Health Awareness Month. It should be more than a month. We could do it all year, but this is a great way to just get some information out about what this great community of ours has, the things that we need to talk about, and make really you, our viewers, aware of what's happening in our community. So we, during the break, we kept talking, and we talked a lot about stigma and what that looks like and what that means. And can you kind of give them the example that you gave me?
Yeah,
okay.
So, you know, a lot of times whenever we have friends or family that are experiencing a physical health condition, so maybe, you know, I broke my leg and I can't get out of bed. You know, my friends, my family, they'll be calling, hey, how you doing? Can we do anything to help you? You know, what do you need? But if I'm struggling with depression, I might not get those phone calls for aid. We don't often think about depression or mental health challenges as, you know, something that a person can use support to help them get through it. But we tend to always do that with physical health. And so really we need to kind of shift our thinking and think about that mental health as, you know, a condition that a person really does need support to get through.
You know, I hate to even say this, but I think I know people are judged. You know, we judge when we hear that someone has that mental health issue or addiction or something. I don't know if it's because we don't know what to do. I don't know if we just think, you know, like you said, all right, let's go, you know, pull your bootstraps up and let's get going. I mean, I don't know why we do that. We need to work on that. I do. But I think, you know, all of us could really need to take a second thought about why we do that.
Yeah, I think that's a good point. Really, it does start with us, and we can bridge that gap just by asking questions and being curious about how our community, our friends, our family, how they're doing, and just ask the question.
Yeah, and we're talking today too about what we do if we know that we have a family member, a loved one, a friend that's struggling. Even if we're trying to help them, maybe that first call is to 211 and just say, I need you to guide me in this direction.
Yeah, I'm so glad you brought that up because, you know, we did talk about 211 or our 988 Lifeline as a great resource. Let's say we do have a person, maybe a friend of ours, is experiencing a mental health challenge and they're in crisis and we don't know what to do. If we call that 211-988 number, same thing, we can be linked to a trained counselor who's going to ask us questions. If it gets to the point where that person, our friend who's in crisis, needs to talk to someone else right now, we can get a trained professional to come out in the community where that person is who's experiencing a mental health crisis.
You're kidding.
If we were here right now at Fairhope and we had someone that needed an assessment to talk to a professional, we could get someone here to do that. So gone are the days of having to go, to the hospital to see a crisis worker and have that assessment. We have folks that can come into the community to meet people where they are and where they're most comfortable.
I can't believe that. That's really incredible. And me working as a social worker all those years ago, when you had a client that was in that situation, I mean, you wanted them to be safe immediately. A lot of times that was a trip to the emergency room.
Yes.
So do you have particular agencies the sources that we talked about earlier?
Yeah.
Are those some of the agencies that you use for that?
Yes.
Wow.
So our contract is with New Horizons Mental Health Services. So the program that I'm talking about is called Mobile Crisis. So Mobile Crisis is just that. They are mobile. They operate 24 hours a day, 7 days a week. So even if there's a crisis that happens overnight, we can get someone to respond to that.
Wow. That's like, the community has to know that.
Yeah, yes.
That's really incredible.
Yes,
okay.
Yes. I think it's very important. It's such a critical service that we do need to spread the word to make sure that our community, our residents know about that resource.
Yeah. We talked already a little bit about if we have someone that we know is struggling with that mental health and that crisis, who to call 211. What other things do you want to touch on throughout this month that you guys are really focusing on?
So we actually, at the ADAMH board, we have every May, or every year, it just so happens to be in May this year, we do an annual dinner. And this will be the first year that we are having our annual dinner as a fundraising event. And this is really special to us because during our dinner, we get to honor 3 community members or community partners who have embodied the mission of the ADAMH board. And so we had some really great nominees this year, and I cannot wait to hear who we are awarding these awards to. But it would be great for the community to come out and support us in that event. All of the proceeds for the fundraiser go back into the community to fund those critical services like the mobile crisis team.
Okay. So how do we find out more information if we want to attend, be a part of that? What do we need to do?
Yeah, so that information is on our website. It's ADAMH.org, ADAMH.org. And I also brought some information here with me today if you'd like to share it with others.
We would. So we talked so much about the resources we have locally, and I'm looking at my little list here of all the agencies that you helped fund. And the Family Adult Children First Council. Can we talk a little bit about some of those?
Yeah.
Okay.
So we are really proud to partner with the council because they are doing some really great programs. A lot of their programs focus on the youth, the high-risk youth in our community. But one of the programs that I think is extra special is their perinatal cluster program. So the perinatal program works with pregnant mothers who have experienced addiction, and it helps link them to resources so that they can have healthy babies and be great parents and just do great things in our community.
Wow, I love that. And that again would be a 211 where we could get that information?
Yeah, so I think, to get more information about that program, it would be 211 can certainly help get that information to the council, but I would say reach out to me at the ADAMH board and I can help make that referral to the council. So 654-0829, that's our phone number at the ADAMH board.
Good, great, thank you for doing that. Can we talk for just a second about the things that we see here sometimes at Fairhope? So, we service a lot of counties. We have a lot of patients that we see. We have patients here at the Pickering House that we take care of. And, On top of this being a difficult time, a terminal diagnosis, we know that all of our families are facing death for a loved one. So oftentimes what happens, and we have a great social work team, we have a great chaplain team, nurses, our whole team is, but those social workers, their role is so important because oftentimes the things that we see, when there is a crisis or a time like this, a change in life, those mental health illnesses really kind of rev up. And so we know that coping, even with the best family, and all of our families have some issues, some things that we struggle with. So even in the strongest families, this is a hard time. And so our social workers are very well versed in looking for all those red flags. Does the family have enough food? Do they have appropriate housing to keep them warm and to keep the indoor plumbing and water, things like that. Also, there's that huge suicide risk. And you talked about the counseling in the homes for the older adults. That's so important because white older male are the highest risk for suicide. And so, a lot of times we're taking care of a spouse and, they don't know what to do and they're facing all of those things. So for us, these resources that you have given us are so important because we have a lot of patients, we focus on each one, but maybe with our support, we're going to reach out to your agencies for that added extra help.
Absolutely. And the agencies can offer a wide variety of services from individual counseling, group counseling, case management to really help link those folks to the resources that they need if they don't know where to go. Because sometimes mental health treatment can be complex, right? And we don't always know as consumers what we need. We just leave that up to them to decide, what's the best route, and then as consumers we can make those choices on what we think is best for us too.
Wow, that's great. And I think oftentimes those families that we encounter have lived with that mental illness at some level for years and years and years. So when we get here, everything's heightened. And then you think, okay, I can't fix this. And it's just so much. It
can be really overwhelming.
It sure can. So I have in front of me this great mission statement of yours. And I love this because the mission and the vision statement I think is so important for what you guys do. And it just says, it's very simple. Your mission is very simple. Create opportunities for Fairfield County residents to be healthy members of their communities. And I think we all want that for all of our families and the people that we work with. And so it feels like you talking about all of these things that you offer, the mental health awareness, it feels like that is truly your vision and your mission.
It absolutely is. We have a great set of staff right now. We have a board that oversees the work that we do. Everybody is just so passionate about behavioral health and really does truly want to just grow a healthier community.
I think we all need to take a part in that and just really focus on that. Take some time for ourselves to look at what's important around us. Let's give your information one more time where anybody can reach you or get more information.
Sure. So I can be reached at the Fairfield County ADAMH board, and my information is on the website. It's www.adamh.org or by phone. So that's 740-654-0829.
Thank you so much for being with us today. This was really a great conversation, and we want it to be easy. We want people to just feel that comfort level to just ask someone how they're doing, help them get in the right spot. So important. Thank you for the great work you're doing.
Thank you.
And come back and see me again. You're welcome anytime.
Absolutely. Thank you so much.
You're welcome. Thank you today for joining us at Fairhope Hospice here at the Pickering House. If you have any questions, anything that you need from us, please call 740-654-7077. Thank you for watching Fairhope Hospice Today.
Interface Video presents Fairhope Hospice Today. Brought to you by Fairhope Hospice and Palliative Care, Fairfield Federal Savings and Loan, Fairfield Medical Center, the Fairfield County Board of Developmental Disabilities, Dagger Law, and the Frank E. Smith Funeral Home.